The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us, in person or virtually, at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection. Hey, welcome back, everyone, to another episode of APIC's The 5-Second Rule. Hey, I'm Silvia Quevedo, your host. We're coming to you on August 25th, 2021, and we're still in the midst of a global COVID-19 pandemic. So today's episode, class is starting, infection prevention and control in educational settings, is going to talk about a highly contentious at times topic around how do we manage our K through 12 students, faculty, and staff. What are some concerns in institutes of higher education? And some concerns around infection prevention and control, not only during COVID-19, but we will also touch upon some other issues to consider and some other diseases and pathogens and nasty critters that can impact our schools. So to help us break it all down, we have Kelley Boston, who is an infection preventionist with nearly 20 years of experience, primarily focused in acute care with pediatric experience. Kelley is the Senior Associate with Infection Prevention and Management Associates, and her background is in public health with a focus in epidemiology. She certainly has served APIC over the years, and we thank her for that. Currently, she is the lead clinical editor for the APIC Text Online, and she's a former communications committee member, an APIC fellow, a 2016 Hero of Infection Prevention. And most importantly for today's episode, she's a parent of a child who's currently too young to be vaccinated and is having to navigate that back to school challenge conundrum on both a personal and professional front. So I think that's going to be key for our discussion today. Welcome, Kelley.
Thank you so much, Sylvia. Really glad to be here today.
So listen, we'll just get right into it. Here at the 5-Second Rule, there's always so much to unpack. We oftentimes only scratch the surface, but I think it's important to start the conversation around how do we protect our children, the staff and teachers in schools across the country during a global pandemic like COVID-19? Just talk to us about what are some of the concerns just from a professional infection prevention and control. What are the challenges that our listeners may not be aware of?
Yeah, so we've been dealing with COVID-19. This is the third school year this is impacting our 2020, 2019-2020 school year. In that spring, many of our schools closed and many children switched to remote or virtual learning. Last school year, the 2020-2021 was a period of really high disruption. Lots of different things happening across the country. And now we're entering that 21-22 school year. And this is our third year of trying to deal with this. And all of this has been in an environment that's been very unstable. This is a new illness that we're dealing with. There's more that we're learning each day, each week, each month as we go along. And we're really trying to almost build that bridge as we're running across it and making those decisions about how we go back to school safely. Some of the big challenges that we face are, how do we keep kids safe from each other? How do we reduce the risk of transmitting infections back and forth between students, between faculty and staff? And how do we do that with the resources that we have in schools? Because we don't often think about it, but when it comes to disease control, schools are often resource-limited environments. You have a large number of students coming from a large number of communities with different levels of understanding of disease transmission, different access to healthcare resources, PPE resources, very different strong opinions on what control measures are appropriate in communities. And you're trying to do all of this quickly with, limited PPE, limited medical knowledge, limited supply, and limited ability to change the physical environment students are in. So there's a lot going on that our school administrators, that our parents, that our healthcare communities trying to figure out together.
Yeah. Oh my God. It seems like incredibly daunting. I will say this. We have a couple of episodes here on the APIC 5-second rule that address airborne transmission. We even have an episode number 19, in fact, on RSV, influenza, and COVID-19. So if we just focus on COVID-19, we're talking about obviously concern around people being too close and breathing in matter that can, if unvaccinated, can cause COVID-19. So just in terms of you as an infection preventionist, talk to us about your experience working with schools or advising schools. And what are some of the questions that come in? What are some things that you're finding you are educating those school districts on about what to do in the
Yeah, so when you're looking at those respiratory viral pathogens, a lot of the things that are normal fall and winter viruses that spread around, and then this new addition of COVID-19, really, as you mentioned, we're looking at controlling those respiratory particles, whether it's something that is airborne and kind of floats in air currents and is inhaled into the lungs, or something that is spread by droplet transmission, which is really more COVID-19, influenza. Those infect when they, are coughed, breathed out by somebody else, and land on the mucous membranes of the face. You're looking at controlling the movement of those particles. So there's kind of three things we can do. The first is spacing students. Can we move them physically further apart from each other? So when you look at the guidelines for COVID-19, it's looking at that 6-foot space. So you look at, can you move them 6 feet apart from each other? When you look at our average classroom size in sort of elementary through high school, oftentimes you have a very full classroom with 25 to 30 kids and a teacher or an assistant or two. You may not be able to physically move them 6 feet apart. So then we look at masking. Can we stop those droplets from landing on the mucous membranes of the face? Can we get everybody in a mask, which both controls the droplets, leaving one person, and protects the next person? So you look at that masking. Can we get masks on everybody in that room? And we can get masks on folks. CDC says we can move that to about 3 feet because the particles don't have a chance to move quite as far. When we're looking at older student populations, so the college, high school, even down into junior high, we have vaccination as an option for COVID-19. And we do have vaccination as an option for all of our children, our school-age children, for many other respiratory infections that circulate. And when we can't get that, then we have to look at what engineering controls can we put into place. How can we increase air circulation in those rooms? If those droplet particles, we can't get them apart. In many areas, we cannot enforce masks due to state and local regulations. Many students we cannot vaccinate. Is there something we can do to reduce the density or the burden of, pathogens in the air? So can we open the windows? Can we increase the airflow and air exchanges per hour? Can we look at non-traditional spaces to put students? So looking at something like your cafeteria and your lunchroom. Do we have to move everybody in at the same time? Is eating outside an option? In areas where the weather may not make that possible, is it an option to, cohort that class and spread them out in another area, in an auditorium, in a hallway area, in a gymnasium? You really got to look and be creative. How can we get that space? How can we get airflow? Really have to address that masking and the vaccination, often at the community level as well. How can we get our communities to buy into masking students when they're at school and when they're in those high contact environments? how can we get parents and children to buy into vaccination to protect them from both COVID and from our seasonal influenza that spreads around?
Well, that's the question of the year, of the past 3 years.
It really is.
Let's just say it. There's a lot of political and emotional feelings around vaccination and masking in certain communities. And as you indicated, the importance of looking at, the rate of transmission, depending on where you are. Let me ask you this. What has been your experience in terms of working with the school nurse or, it's been a lot of years since I've been in elementary or high school, but you have the school nurse. Have you had occasion to interact with that individual from an infection prevention and control perspective? And can you share, their level of comfort and knowledge around what to do? Or is that a scope of practice? Look, I'm the school nurse. I just deal with what comes into my office. Or how are they engaged with the process of being, how can we make this work, getting our kids back into school?
Yeah, so I think there's several different levels we can have influence on. So first is that classroom and that school administration. Done a lot of work kind of working with classroom teachers. Do you understand what you need to do? Do you have questions? Are there solutions that we can help you solve for that spacing, that masking, those control measures? Working with school administration, as I said, on things like spacing and alternative care areas. School nurse, the scope of practice with the school nurse has changed a whole lot in the last 3 school years. Many of them are very engaged in screening and making sure that if a child does become symptomatic, that we can get them out of school and out of contact with the others. Making sure parents and families have access to resources on testing and on treatment and questions being answered. I would like to point out that particularly in public schools, not every school has a school nurse. And so you've got other folks that are trying to fill that position and doing the very best they can. I will say, many of my interactions with school level administration, many of them feel frustrated and unable to make certain changes. There's things they know they could be doing or should be doing, but they don't have the ability to, either due to school district regulations or state prohibitions on things like masking. And really then it becomes partnering with them to say, what can you do? What can you not do? And how can we make the best possible decisions given the restrictions that we're in? I'm in the state of Texas. Right now, this is airing in mid-September. We're recording this at the end of August. We have a state executive order that says public entities like school districts cannot enforce mask mandates, which means schools cannot require students to wear masks. But particularly at the elementary school level, that's one of the few tools we have that can intervene in these. So we've got a number of state school districts that have enacted mask mandates and are currently working through legal challenges with the state. So you've got a lot of uncertainty. You've got a lot that we're doing for community advocacy, really trying to kind of educate the community, but a lot of schools, they are very restricted in what they can enforce and may not have the community pressure to enforce masks. They may not have the legal capacity to challenge a state order and are kind of waiting to see what some of these legal cases will settle out as. I know in many states, in many areas, this is something that they are faced with is community resistance to masking or barriers to enforcing masking in schools. So at that point, you're working with the classroom teacher, you're working with the administration, you're working with the parent-teacher organizations to see what can we do given the restrictions that we have in place.
Wow. Well,
like a lot of COVID, it is trying to make the least bad decision at the time. And then when situation changes, trying to make the next decision and always striving for how can we keep as many people as safe as possible.
Absolutely. Yeah, certainly. Let's talk a little bit also about an unfortunate consequence of COVID-19 is we are hearing that the usual mandatory vaccines for children, your measles, your mumps, your rubella, are also of concern because, of course, during the pandemic, many individuals were either unable to or nervous about accessing healthcare and getting those routine vaccinations. Can you talk a little bit about what you're seeing in your community or in your practice as an infection preventionist? Because let's not forget, there are plenty of other pathogens. I'm thinking measles. We are hearing that from some of our APIC members in the children's hospitals that there's an increase in RSV, respiratory syncytial virus. Of course, influenza is a concern. Talk to us about what you're hearing, what your experience has been regarding that.
Yeah, like you said, particularly during 2020, we saw a lot of delays in care. Either folks that were very hesitant to come seek health care for that routine preventative care or things that felt minor at the time, partly due to, fear, concerns about coming into contact with folks in the hospital or in the clinic, and partly due to availability. Right now, you're hearing the same story across the nation. Our hospitals are full. Our clinics are very busy. So getting those appointments can be challenging. So we've got a lot of delays of care, and that has impacted things like our routine vaccination schedule, particularly in early childhood. There's a fairly tight schedule that folks are moving through. And if you delay those, you're potentially leaving yourself open to community spread of infection. The more delayed vaccinations we have, the more kiddos we have potentially at risk, which could then lead to clusters and outbreaks of infection. I don't have a good handle on whether there is more resistance to getting those vaccines now, or if folks are kind of leaning into already existing resistance, or if it is just an access issue and a concern issue. Either way, it puts us at increased risk of having clusters and outbreaks in our schools and our communities. Last year we had a good year with influenza. We had very few influenza cases last year. And that was, potentially due to flu, potentially due to some of the kind of social and behavioral control measures we had in place, the spacing, the remote schooling, the masking. But like we've seen with RSV, normally we see that later in the year. We see that kind of fall and winter, and we've seen in many areas just an explosion of RSV cases. After kind of our summer surges, things started to feel better. They started to go back to normal. I think we lost a lot of those, distancing and behavioral control measures that we had in place, and started to spread some of those respiratory illnesses earlier than we usually do each year. So you've got sort of the RSV impact that folks are having. You've got the newest COVID surge that many of our communities are in, and they're compounding on each other. And I think that is going to potentially magnify that problem of delayed care, delayed access for those that are not impacted by COVID and RSV, or don't have health impacts for those, but may not be making those routine pediatrician appointments just due to concern.
Yeah, and I think it's important to note here because I can envision some of our listeners saying, "Well, what's the big deal? These are kids. I heard that kids don't get that sick from COVID." So I think it is important to highlight that, when we talk about vaccination and minimizing the spread, it's also about protecting that healthcare system and ensuring that, when people need to get to the hospital, they can. So that's part of it. But let me ask you as a parent, Kelley, because you have a small child. Talk to me a little bit about, you as a parent and some of the things that you're having to navigate and some of your thoughts and feelings around what's going on.
I'm going to push back a little on that. COVID isn't a severe impact for kids. Now, the vast majority of children who get COVID are going to have a minor illness. They're going to be just fine. But we do have some pretty severe impacts that children can face for COVID. About 1 out of 1,000 kids will get something that we call MIS-C, multisystem inflammatory syndrome, which is a post-infectious inflammatory syndrome that's associated with prior COVID infection, can inflame the heart. It can cause very severe infections and can lead to death, again, in a very small proportion. We also have about 4% of children that a month after their infection are still showing signs and symptoms and are still being impacted. That is 1 out of 21 kids, and that is not a small number. That is not a small impact. And when you're looking at impacts on education, That's time out of school. That is time that is, healthcare impact. That is medical trauma. That is, financial burden on their family. That is time out of school, and you're not going to be able to learn too well if you're still having symptoms a month later. So this is not a small impact on our pediatric population. Some of those kids have symptoms. I think it's about 2% that have symptoms about 2 months out. So these can be, a very significant family impact and a very significant impact on that child. I think we need to kind of look at those perceptions of, small impacts on children. We also have that risk of children transmitting to others that may be higher risk. So elderly grandparents, family members that may be at high risk, family members who, may be immunocompromised, as children that may be immunocompromised. So it is a much bigger issue than children are probably going to be okay after they have COVID. So that's sort of the medical, clinical. Your other question is kind of the challenges that we are having to navigate. So I have a child in elementary school. They are too young to be vaccinated. Their entire building of students is too young to be vaccinated. And they're in a public school. And so we're impacted by, state decisions and state regulations as well. So we both look at, what resources and support can we provide to the school to make things as safe as possible? How can we kind of share expertise and help them make decisions? And then we're looking at our family members' decisions. We stayed remote for most of last year because we had, high-risk family members that they could potentially transmit to, and we had the resources to be able to do so. My mother was able to take most of our time to, she retired several years ago and was able to provide that, remote support and coverage for my child while they were doing remote school. She's also 74 years old. To have your fall plan for education be a 74-year-old that you're trying to prevent from also getting COVID. My father lives in an assisted living facility, so we had to be very cautious about what could we potentially bring to him once we were able to visit again. How do we protect that extended family unit as a point of contact? So you're looking at things like childcare. You're looking at things like remote schooling. You're looking at things like equity of access to remote schooling. Not everybody has the same ability to provide childcare. In our community, we have a huge issue with, do we have internet everywhere? That is not considered a basic utility. So you have many communities that do not have the internet access needed to do remote schooling, do not have the devices they need to, do not have a safe place to be during the day while folks are at work. You saw huge impacts, particularly on working women. I believe in January they announced 800,000 women left the workforce to try and care for children who were not able to be safely educated in school. As we return this year, we have situations where many states and school districts have eliminated remote schooling entirely. So you now are bringing all these children back into school. And so how do you keep them safe? We're looking at things, do we have well-fitted masks? Do we have respirators for, when she's in music class? And what if they do PE inside? Is it safe to wear a respirator or does she need to be in a regular mask? We are, personally in our family, we're pulling her out of school every day for lunch. The school that we were at could not achieve spacing in lunchroom. So we pull her out, we sit outside in the heat, we eat lunch, and we send her back in. Sort of have a parent and family rotation so that, she can be safe. Again, that is a huge privilege that we have the resources to be able to do that. We're working with the school to look at where we can space. Our school community has done a lot of work to look at where can we bring in air filters. How can we move children through so that we are trying to get as much airflow into the school building as possible. But it's hard. It's not easy, and we are limited in what we can do.
Yeah, we're certainly hearing that not only from our members, but even the APIC staff. We're in a lot of our staff have kids, and it's a challenge around the country. And I think you've raised some important points around, and certainly for people to consider that this is a big deal, even for small children who can be impacted greatly, or who have a ripple effect, or there's a ripple effect in terms of sequelae long after COVID. We haven't touched too much on teachers, staff. because right now, a few days ago, the FDA approved Pfizer. So some of these vaccination mandates, conditions of employment in some places will impact staff and teachers at a school. Of course, there are people on both sides of that argument, but certainly from an APIC perspective, we are very supportive of vaccination as a condition of employment, certainly in healthcare settings, and certainly support vaccination in general for vaccine preventable illness. What has been your experience with staff and teachers? What might you say to an infection preventionist who is going to be working with that community? Anything to add on that?
I can only speak anecdotally. Early in the vaccination, there were many, many teachers that very much wanted to get the vaccine. At least in the teacher community that I'm aware of, they had fairly high uptake. We certainly do have folks that are resistant to it. But teachers, again, are in a position where they are exposed to a very high number of students each day, particularly at those schools that are rotating through students in classes. So they have a very high risk of exposure. They still have to be effective teachers. They still have to connect and communicate with their students. They often are, again, limited in their ability to effectively space. Working with teachers, many of the ones I work with have been strong proponents of vaccination, of masking, of spacing, but really seeking to understand what their concerns are and what their questions are, because it's going to be different in every community. You're going to have some teachers that, are fully on board with masking, but need help figuring out how can I conduct my classes in person safely. You're going to have those that are hesitant to vaccination but are fully on board for PPE. You're going to have those that feel that they struggle to teach with a mask on, particularly for some of those early childhood, for some of those speech and language teachers, some of those special education teachers that are really trying to find alternate solutions to connect with kids that may have very challenging learning needs. So really speaking to them, understanding what their needs are, and then helping them connect with the correct resources, making sure that they have accurate, valid information, because we are dealing with a pandemic of misinformation and disinformation as well. So make sure that they are getting truthful information, and then helping them figure out solutions to their particular problems. They are an incredibly creative and resilient and caring and passionate bunch. So they are going to have ideas, and they just may need a little nudge from you of what may be safer, how they might figure things out. They are problem solvers like no others. So making sure they have the information they need and being there to answer their questions from the place that they're coming from.
So Kelley, let me ask you this. APIC just updated its vision and mission. Our vision is a safer world through the prevention of infection. And the mission is to advance the science and practice of infection prevention and control. And what's important here is our members and the work of APIC going forward is going to include not only healthcare settings, but really, you name it, all other settings where disease can spread, as we've seen through this pandemic. So what would you say to your fellow infection preventionists about your experience, or just real quickly, tell them what you've enjoyed in terms of being an infection preventionist consulting with educational settings and K through 12 schools?
So I think, our healthcare systems and the health of our patients in our healthcare systems is built upon the health of our patients in our communities. We cannot have, a world without infection in our hospitals without also doing that for our communities. What happens there will come in your doors and make other things more challenging. We've seen it with our, CLABSI and CAUTI rates. You're seeing more and more data that as these surges of COVID hit, it's impacting our, device-associated infections because it's straining resources. So I do think, infection preventionists have an incredible and unique skill set. We are very good at understanding patterns and connections between, behaviors and systems and how they affect patient outcomes. That is the same in your community. You have a wealth of knowledge in infection prevention, in health and safety. And I would encourage all infection preventionists to be an advocate, be a resource. It doesn't have to be formal consulting, answer those questions for folks because you have knowledge that many other folks don't. You have expertise that many others don't, and use that to support your community. Use that to support those around you.
Thanks, Kelley. Oh my God, there's so much here, right? We just scratched the surface, but it is important. It is timely. COVID-19 is with us. And again, we talked a little bit about a few other pathogens that can impact schools, especially like RSV, measles, and others. So, Kelley, thank you so much for your time today on the 5-second rule. As a reminder to our listeners, you will want to definitely check out another great APIC podcast that it's brand new. I was going to say fairly new, but it's brand new. And that is APIC, Science into Practice, which is going to highlight some American Journal of Infection Control articles related to infection prevention across the continuum of care. And to access that, you'll want to go to apicintopractice.org. So again, thank you, Kelley, and we look forward to sharing more information at www.apic.org.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphen.